What makes beta-3 agonists relax bladder muscles safely? Imagine a way to help your bladder hold more without causing unwanted side effects. That's what beta-3 agonists do by targeting specific receptors in your bladder muscles. These receptors are called beta-3 adrenergic receptors and are mainly found on the smooth muscle layer of the bladder, known as the detrusor muscle. When these receptors are activated, they send signals inside the muscle cells that tell them to relax. This relaxation increases the bladder's capacity, making it easier to hold urine and reducing symptoms like urgency and frequent trips to the bathroom. The process begins when a beta-3 agonist binds to these receptors. This activates an enzyme called adenylyl cyclase, which then produces a molecule called cyclic adenosine monophosphate, or CAMP. Higher levels of CAMP activate another protein called protein kinase A. This protein then modifies certain proteins inside the muscle cells that control contraction, specifically by reducing calcium's role in muscle tightening. As a result, the muscle fibers relax during the filling phase of the bladder, helping to prevent involuntary contractions that cause urgency. In addition to this, beta-3 agonists may open potassium channels known as large conductance calcium-activated potassium channels. When these channels open, potassium ions leave the cell, causing the cell membrane to hyperpolarize. This makes the muscle cells less excitable and further promotes relaxation. This combined effect of increasing CAMP and opening potassium channels ensures the bladder can fill more comfortably and reduces the feeling of urgency. Another important aspect of beta-3 agonists is their influence on bladder nerves. They seem to modulate sensory nerves that send signals of urgency to the brain. By dampening these signals, they help decrease the sensation of needing to urinate urgently, which is a common problem in overactive bladder. This nerve modulation adds to their ability to improve bladder storage without impairing the ability to empty the bladder normally. From a safety standpoint, beta-3 receptors are less involved in heart and lung functions compared to other receptors called beta-1 and beta-2. This means that drugs targeting beta-3 receptors tend to have fewer cardiovascular side effects like increased heart rate or blood pressure. Unlike older treatments that block muscarinic receptors and often cause dry mouth, constipation, or cognitive issues, beta-3 agonists are generally well tolerated and suitable for long-term use. While beta-3 agonists are not used directly to treat bladder cancer, they are valuable for managing bladder symptoms in patients with various bladder conditions. Their targeted action helps improve bladder capacity and comfort without interfering with cancer treatments or causing systemic side effects. Overall, they offer a safe and effective way to help people with overactive bladder symptoms enjoy better quality of life, thanks to their precise mechanism of relaxing bladder muscles and calming sensory nerves. Remember, always consult a healthcare professional to see if this treatment is right for you and to discuss any concerns about your bladder health.